The Alzheimer's enigma, a growing crisis. Alzheimer's disease is a devastating illness that robs individuals of their memories, cognitive abilities, and ultimately, their lives. It affects millions worldwide, and its prevalence is steadily rising. Despite decades of research, the exact causes of Alzheimer's remain elusive, making it one of the most challenging medical mysteries of our time. Scientists have long suspected a complex interplay of genetic and environmental factors, but a definitive understanding has remained out of reach. However, recent breakthroughs have shed new light on a potential culprit: common viruses. Unmasking the culprit. Could viruses be the missing link? For years, the idea that viruses might play a role in Alzheimer's disease was considered controversial. Many in the scientific community dismissed it as a fringe theory, lacking substantial evidence. However, a growing body of evidence suggests that certain viruses could be linked to an increased risk of developing this devastating neurodegenerative disorder. This evidence is compelling enough to warrant a closer look. Among these suspects are common viruses like shingles, herpes simplex virus, which are known to cause cold sores and genital herpes, and even the chickenpox virus, varicella-zoster virus, which can reactivate later in life as shingles. These viruses, often considered relatively harmless in their initial infection, have the ability to lie dormant in the body for decades, potentially reactivating later in life and wreaking havoc on the nervous system. This reactivation could be a key factor in the development of Alzheimer's. This potential link between common viruses and Alzheimer's has profound implications for public health. It challenges us to rethink our approach to both viral infections and neurodegenerative diseases. If these viruses are indeed contributing to the development of this debilitating disease, it opens up new avenues for prevention and treatment. Researchers are now exploring antiviral therapies and vaccines as potential strategies to combat Alzheimer's. Imagine a future where a simple vaccine could significantly reduce the risk of developing Alzheimer's, offering hope to millions worldwide. This could revolutionize our approach to aging and cognitive health, providing a brighter future for generations to come. The Shingles Dementia Connection, a breakthrough from Stanford. A groundbreaking study conducted by researchers at Stanford University has provided compelling evidence linking shingles, a painful rash caused by the reactivation of the chickenpox virus, to an increased risk of dementia, including Alzheimer's disease. This discovery is particularly significant as it opens new avenues for understanding how viral infections might contribute to neurodegenerative conditions. The study, published in a prominent medical journal, analyzed data from millions of patients and found a significant association between shingles and subsequent dementia diagnoses. The comprehensive nature of this research adds weight to the findings, making it a pivotal moment in medical science. The Stanford researchers discovered that individuals who had experienced shingles were approximately 30% more likely to develop dementia compared to those who had never had shingles. This startling statistic underscores the importance of monitoring patients who have had shingles for early signs of cognitive decline. This increased risk was particularly pronounced in the year following a shingles outbreak, suggesting a potential temporal relationship between viral reactivation and the onset of cognitive decline. The timing of this risk factor highlights the need for timely medical intervention and further research. These findings have sent shockwaves through the medical community, igniting a renewed focus on the role of viral infections in neurodegenerative diseases. The implications of this study could lead to new preventative measures and treatments, potentially altering the landscape of dementia research and care. Oxford University lends support, validating the link. The Stanford study is not alone in its findings. Researchers at Oxford University conducted a separate, independent study that further supports the link between shingles and dementia. The Oxford team analyzed data from a large population-based cohort study and found a similar association between shingles and an increased risk of developing dementia. This independent confirmation of the Stanford findings strengthens the evidence for a causal link between shingles and dementia. The consistency of results across multiple studies, using different data sets and methodologies, adds significant weight to the hypothesis that viral reactivation may be a contributing factor in the development of Alzheimer's disease and other forms of dementia. Unraveling the mystery how viruses might trigger Alzheimer's. While the exact mechanisms by which viruses might contribute to Alzheimer's disease are still being investigated, Several intriguing hypotheses have emerged from recent studies. One leading theory suggests that viral infections may trigger a chronic inflammatory response in the brain, which could be a significant factor in the development of Alzheimer's. This persistent inflammation, while initially intended to fight off the virus, can become damaging over time. It leads to the accumulation of toxic proteins and neuronal damage, which are characteristic features of Alzheimer's disease. Another compelling hypothesis proposes that viruses may directly infect brain cells, disrupting their normal function and contributing to neuronal death and cognitive decline. Certain viruses, including the herpes simplex virus, have been shown to have a particular affinity for brain cells. These viruses have been detected in the brains of Alzheimer's patients, suggesting a possible link. This suggests that direct viral infection of brain cells could play a significant role in the disease process, potentially opening new avenues for treatment and prevention strategies. Expert opinions, leading scientists weigh in. The potential link between viruses and Alzheimer's disease has garnered significant attention from leading scientists and clinicians worldwide. Dr. Maria Carrillo, Chief Science Officer of the Alzheimer's Association, remarked, "This is a rapidly evolving area of research, and while more work needs to be done to fully understand the relationship between viruses and Alzheimer's, these findings are intriguing and warrant further investigation." Dr. Joshua Miller, a neurologist specializing in dementia at the University of California, San Francisco, added, "If we can confirm that viral infections are indeed a significant risk factor for Alzheimer's, it opens up exciting new possibilities for prevention and treatment. Vaccines, antiviral medications, and other strategies targeting viral activity could potentially reduce the burden of this devastating disease." Hope on the horizon. Vaccines and the future of Alzheimer's prevention. The discovery of a potential link between shingles and Alzheimer's disease has ignited hope that vaccination could play a crucial role in preventing this devastating neurodegenerative disorder. The shingles vaccine, already recommended for adults over 50 to prevent the painful rash, could have the added benefit of reducing the risk of dementia. Clinical trials are currently underway to investigate the potential of the shingles vaccine in preventing Alzheimer's disease. These trials will provide valuable data on the effectiveness of vaccination in reducing dementia risk and could pave the way for widespread vaccination programs targeting Alzheimer's prevention. Beyond shingles, exploring other viral culprits. While the link between shingles and Alzheimer's disease has garnered significant attention, researchers are also investigating other viruses that may contribute to dementia risk. The herpes simplex virus, responsible for cold sores and genital herpes, is another prime suspect. Studies have shown a higher prevalence of herpes simplex virus in the brains of individuals with Alzheimer's disease compared to those without the disease. This suggests that herpes simplex virus infection may play a role in the development or progression of Alzheimer's. Further research is needed to fully understand the relationship between herpes simplex virus and dementia, and to explore potential preventive and therapeutic strategies. A call to action advancing research and treatment. The discovery of a potential link between viruses and Alzheimer's disease underscores the urgent need for continued research in this area. Further studies are crucial to confirm these findings, elucidate the underlying mechanisms, and develop effective preventive and therapeutic interventions. Increased funding for Alzheimer's research is essential to accelerate progress towards a cure. Government agencies, private foundations, and pharmaceutical companies must prioritize research in this area to alleviate the suffering caused by this devastating disease. The power of prevention, protecting ourselves and future generations. While research continues, there are steps we can take to reduce our risk of Alzheimer's disease and other forms of dementia. Maintaining a healthy lifestyle, including regular exercise, a balanced diet, and adequate sleep, can promote brain health and reduce the risk of cognitive decline. Protecting ourselves from viral infections through vaccination and other preventive measures is also crucial. By reducing our exposure to viruses, we may be able to lower our risk of developing Alzheimer's disease and other neurodegenerative disorders. Towards a brighter future, a world without Alzheimer's. The discovery of a potential link between viruses and Alzheimer's disease has opened up exciting new avenues for research and treatment. While a cure for Alzheimer's remains elusive, The possibility of preventing this devastating disease through vaccination and other interventions offers hope for a brighter future. By continuing to invest in research, raising awareness, and promoting brain health, we can work towards a world without Alzheimer's, where memories are cherished, minds remain